You don't need to read 50 lawsuits. I already did. And what I found will change how you run your business. Nearly every case came down to three things: sloppy hiring, bad documents, and ignoring rules you didn't even know existed. In this episode, I'll show you the patterns I saw and how to make sure your clinic never ends up in the courtroom. Stick around till the end, and I'll give you a free checklist to audit your own business before a regulator does. So to kick us off, I'm going to talk about a client that came in and they did not have any documentation. And this all came to light because a patient actually was asking for a refund at a medical clinic. So here's what happened. There was no documentation of the supervision between the medical doctor and their staff. Also, when I asked for a copy of the files as the attorney, there really was no documentation of the procedures themselves. So without any of that, what happened is that we were in a situation where the patient could effectively say whatever they wanted. And they could say that to the medical board. They could say that in terms of getting a refund or maybe a potential malpractice lawsuit. And we, as the medical clinic, didn't have anything to back it up. We didn't know how to show our math. And so this, like many legal actions, start long before lawyers get involved. It all starts with just good written documentation from the get-go. And in this case, it actually hit on all three. It's going to be the top three that I see in lawsuits: improper supervision, which is also not in any sort of written contract, and then finally bad documentation in the medical record. And I think solo founders are especially vulnerable because you're so focused on usually good patient care and just running the business and getting things set up, and you forget all the little nuances of what would be pretty simple documentation. And so the pattern here, I'm going to go into how you could easily avoid this, how to actually get that documentation in place and not turn into this clinic where you're facing a patient legal action that then is putting your supervision and your medical documentation right in the face of a regulator. So what are the real world implications of not having any written documentation connecting the clinic together? Let's break it down. Well, first, you have to watch all my videos by subscribing to the channel. But seriously, if there's one thing I want you to get out of this podcast and this episode, it is that you could always get a new business, but you can't get a new name. And so what I mean by that is that documentation errors and supervision errors, yes, they could tank your business. That is a big deal. That is absolutely a big legal deal. But you could start a new business in theory. Your insurance policy may cover it. Okay, that's all right. But you can't get a new name when you're a licensed professional. And even if you did, you would still have all of your reputational things that went wrong following you forever. So your name is your most important thing. Your name is everything when you're a licensed professional. You spent hundreds of thousands of dollars, usually just in time alone, but also getting your medical degree, getting your licensure, setting up the business. Why would you let all of that go away just because we didn't have some pretty simple documentation? You could lose your career over one missing written document, and that's just unnecessary. And so what we've done is I've created a checklist that just has everything that I would like to see as a business and healthcare attorney in terms of supervision, documentation, connecting all of the parts together in the clinic. And you can use that as a basis to figure out which parts of your medical business are exposed and to actually put that written documentation in place. Because again, yes, losing a business is a big thing, but your name is worth much more. So let's protect that reputation. Every lawsuit I read could have been avoided with three systems: one for hiring, one for documentation, and one for supervision. Let's first talk about hiring. I have the checklist right here, and it's amazing how many providers forget what feel like pretty simple things. So just to give you an example of the hiring checklist, and hopefully you're already doing these things. For starters, simply verifying their license and certifications. So you're simply verifying that if they say they're a nurse, a doctor, they have some sort of training or certification, that it actually exists. Number two, you're going to do a background check And also in healthcare, we often need to do what's called an exclusion list screening. This is so that we're checking federal records to make sure that somebody didn't accidentally do something bad with the federal government, and we happen to be hiring them as a small business. We wouldn't want to be on the hook for that. The third thing in the hiring checklist is just going to be a HIPAA training and acknowledgement, plus with any state required medical privacy training. The fourth one, as an example, is going to be an offer letter with a clear description of their job duties. And the fifth one's going to be a full-on new hire onboarding and policy review sign-off. Are they signing off on all of your training? So that way we can say, listen, we train them if they're an employee, or in the alternative, if they're a contractor, that they actually did the training themselves and prove to you that they did it. That's an example for the hiring checklist. Let's move on to medical documentation checklists. I got some more examples right here too. So in there, we're going to have a nice, clear system for how we do every medical record. I'd like to see the date, time, and a legible provider signature, identifying who it is that actually did the procedures. This can all be done electronically usually, but I need to see that in every single medical record. We also want to document medical necessity and support for the services billed. This includes when we're working with non-medically necessary procedures. I want to see the informed consent. It's amazing how many providers don't have a simple informed consent saying, I want these services, here they are. Then I want to see the medical history. Did we actually do a relevant medical history based on the procedure that we're doing? Document that before we actually move on. And finally, this is going to be relevant in some situations. It's going to be the discharge instructions or a follow-up plan. So if I did a procedure, are there any things that I need to do when I go home, right? The follow-up plan. Do I come back for another visit? Is there healing instructions? Should I not touch, my face because something was done there? Discharge would be, listen, we did the procedure. We're letting you go. We think you're okay to go home. And we have the instructions for what to do and what not to do. Finally, the supervision checklist. This one's pretty interesting. So what we actually want to do is verify the scope of practice, that what we're even supervising can be done. There's an assumption that just about anything and everything can be delegated, and that's not necessarily true, especially depending on what state you're in. I also want to see a regular chart review with the supervisor's signature on it. So how many of those you do and how frequently is going to depend on what state you're in. But I at least want you to think about and have some sort of process for that. We're going to have some sort of emergency protocol and availability documentation. So if you're out on vacation, which you absolutely should be able to do, or you're on a plane, you're not available, we need some sort of documentation as what we're going to do for emergencies. Is it straight to the ER? Is it another provider? We need something in place there. We're also going to do performance evaluations and competency assessments. We need to make sure the people that we're supervising actually know what the heck that they're doing, so that we can protect our license, because it's going to be our license that's usually on the line when there's any sort of medical or nursing board complaint. And finally, we're actually going to have written documentation in a supervision plan. So the supervisee, the supervisor agree exactly in writing as to what's in there. These are just examples, not a comprehensive list of what's in these checklists. So if you want to get those, go down the link below and we'll get them over to you. I really hope this helps simplify this really complex situation for you. Remember, make sure to click the link in the description to get that checklist today. Next time, we're breaking down how to legally hire 1099 contractors in healthcare and avoid the nightmare of misclassification lawsuits. Don't miss it.